Most people have no idea that bone cancer is one of the most frequently misdiagnosed conditions in modern medicine, often mistaken for common aches and pains that millions experience daily. What's truly alarming is how this disease hides in plain sight, masquerading as everyday discomfort while silently progressing beneath the surface. Consider this. By recognizing just a handful of subtle warning signs, you could potentially save your own life or the life of someone you care about. Bone cancer, particularly in its early stages, is a master of disguise. With survival rates dramatically improving when caught early, jumping from 30% to over 70% in many cases, early detection is quite literally a matter of life and death. Yet shockingly, research shows that nearly 65% of patients dismiss early symptoms as simple aging, overexertion, or minor injuries for months before seeking medical attention. Here's the critical information. Medical studies now reveal that most bone cancer patients experience noticeable symptoms up to 9 months before diagnosis, offering a crucial window for intervention that too many people unknowingly miss. Your skeletal system, though seemingly silent, is actually one of your body's most active tissues, constantly rebuilding and remodeling itself. This makes it particularly vulnerable to cancerous changes that can develop undetected while sending subtle distress signals. In this video, we'll reveal 8 surprising symptoms of bone cancer that many people completely overlook, some so commonplace they're routinely dismissed as nothing serious. And here's the breakthrough insight. According to recent oncological research, recognizing patterns of these symptoms together increases early detection rates by nearly 80%. Why does such a detectable condition continue claiming lives unnecessarily? Why isn't this vital information part of every medical checkup or health conversation? If you find this video helpful, please like and subscribe to help us spread potentially life-saving knowledge to those who need it most. Now, let's explore the first critical warning sign. Persistent deep pain. Bone cancer creates a distinctive type of pain that differs significantly from common aches or injuries. Unlike muscle strains or typical joint discomfort that improve with rest, bone cancer pain often intensifies during periods of inactivity, particularly at night. Many patients describe it as a deep, persistent aching or throbbing that seems to originate from within the bone itself rather than the surrounding tissue. What makes this pain mechanism particularly concerning is how it progresses. Initially, the discomfort might come and go, giving false reassurance that it's nothing serious. Over time, however, it becomes more constant and intense as the tumor grows and puts pressure on surrounding nerves and tissues. The pain doesn't respond well to over-the-counter pain relievers, which is another red flag that something more serious may be developing. The location of this pain can provide valuable diagnostic clues. Long bones in the arms and legs are common sites, particularly near joints, but bone cancer can affect any bone in the body. For children and young adults, pain around the knee is especially noteworthy, as this area is a frequent location for osteosarcoma, one of the most common bone cancers in younger populations. While bone pain is extremely common and usually harmless, what distinguishes potentially cancerous pain is its persistence, progressive worsening, and tendency to disrupt sleep. When pain follows this pattern and lasts more than a few weeks without clear injury or cause, it deserves prompt medical evaluation. This isn't about creating unnecessary worry, but rather recognizing that this particular kind of persistent, deep bone pain might be your body's early warning system trying to alert you to a serious condition while there's still time for effective intervention. Unexplained swelling or mass. When bone cancer develops, it often creates visible changes that shouldn't be overlooked. As tumor cells multiply within the bone, they can cause the bone to expand outward, creating noticeable swelling or a lump that wasn't there before. This swelling typically develops gradually over weeks or months rather than appearing suddenly, like an injury-related swelling would. What makes this symptom particularly telling is that the swelling often feels firm or hard to the touch, unlike the soft swelling associated with inflammation or fluid buildup. In some cases, you might even notice that the affected limb looks slightly different in shape or size compared to the opposite side of your body. This asymmetry can be subtle at first, but becomes more pronounced as the condition progresses. The swelling may or may not be painful when touched, which sometimes leads people to ignore it if it doesn't hurt. However, painless swelling can be just as concerning as painful swelling when it comes to potential bone cancer. The location matters too. Swelling near joints, in long bones of the arms and legs, or in the pelvis deserves particular attention as these are common sites for bone cancer to develop. While many benign conditions can cause swelling, persistent swelling that doesn't improve over time or continues to grow warrants medical evaluation. Modern imaging techniques like X-rays, CT scans, and MRIs can help determine whether bone abnormalities are present and guide further diagnostic steps. Remember that early detection of bone cancer significantly improves treatment outcomes, making this seemingly minor symptom something that should never be dismissed without proper medical assessment. Unexplained fractures. One of the most alarming ways bone cancer announces its presence is through pathological fractures, bones breaking with minimal or no apparent trauma. These fractures occur because cancer weakens the bone's internal structure, making it fragile and susceptible to breaking under normal stress that healthy bone would easily withstand. Imagine going about your daily routine, perhaps reaching for something on a shelf, stepping off a curb, or even turning over in bed, when suddenly you hear a crack and feel intense pain. These fractures can happen during ordinary activities because the cancer has been silently compromising your bone strength for months. The bone essentially reaches a breaking point where it can no longer support even normal forces. What makes these fractures particularly concerning is their location and timing. When fractures occur in unusual locations or happen without adequate explanation, they deserve immediate medical attention. Areas commonly affected include the long bones of the arms and legs, the pelvis, and the spine. In some cases, patients report hearing an audible snap or crack at the moment of fracture, followed by severe, immediate pain. The healing process for these fractures often differs from typical breaks as well. Because the underlying bone is diseased, these fractures may heal slowly or incompletely even with proper treatment. This delayed healing can be another valuable clue for medical professionals investigating the cause of a break. While many fractures have innocent explanations, unexplained breaks, especially in adults without osteoporosis or other known bone diseases, should trigger further investigation. X-rays and other imaging studies can reveal not just the fracture itself, but also potential abnormalities in bone density or structure that might suggest an underlying tumor. Recognizing these pathological fractures as a potential symptom of bone cancer rather than just an unfortunate accident could lead to earlier diagnosis and potentially life-saving treatment. Decreased mobility and stiffness. As bone cancer develops, it can significantly impact your normal range of motion in ways that are easy to dismiss as simple aging or minor injuries. You might notice a progressive stiffness in joints near the affected bone, making movements that were once effortless increasingly difficult or uncomfortable. This stiffness tends to be persistent rather than temporary and often doesn't improve with rest or common remedies. What distinguishes cancer-related mobility issues from ordinary stiffness is its progressive nature and specific pattern. Rather than affecting multiple joints symmetrically as with arthritis, bone cancer typically affects movement around a single bone or joint area. You might find it increasingly difficult to fully extend or flex the affected limb, or you might develop a noticeable limp if the cancer affects weight-bearing bones in the legs or pelvis. This reduced mobility often develops gradually, making it easy to adapt unconsciously to the limitations rather than recognizing them as a warning sign. You might find yourself modifying activities without really noticing, perhaps avoiding certain movements, using the opposite arm for tasks, or relying more on supportive devices without questioning why these adaptations have become necessary. Morning stiffness that typically improves throughout the day with arthritis tends to remain constant or worsen with bone cancer. Additionally, the stiffness may be accompanied by muscle weakness around the affected area as your body naturally tries to protect the compromised bone by limiting movement. While decreased mobility has many benign causes, persistent stiffness that continues to worsen over time, especially when localized to one area and accompanied by other symptoms like pain or swelling, deserves professional evaluation. Physical examinations and imaging studies can help determine whether there are structural changes in the bone that might be limiting motion. Recognizing these mobility changes as potential symptoms rather than inevitable consequences of aging or activity could help identify bone cancer at earlier, more treatable stages. Unexplained weight loss and fatigue. Bone cancer creates a hidden battle within your body that can dramatically affect your energy levels and weight in ways that aren't immediately obvious. As cancer cells multiply and spread, they demand increasing amounts of nutrients and energy that would otherwise nourish healthy tissues. This metabolic theft creates a situation where your body is working overtime, yet steadily losing ground. The resulting fatigue isn't just ordinary tiredness that improves with rest. Instead, it's a profound, persistent exhaustion that seems disconnected from your activity level or sleep quality. You might find yourself needing to rest after minimal exertion or experiencing a heaviness in your limbs that makes even routine tasks feel overwhelming. This bone-deep fatigue often coincides with unexplained weight loss, pounds dropping off despite normal or even increased food intake. What makes these symptoms particularly deceptive is how gradually they develop. Many people attribute the weight loss to positive lifestyle changes, or the fatigue to stress, aging, or overwork. In reality, these changes may reflect your body's resources being diverted to fight the growing cancer. Your immune system is constantly engaged, increasing your body's energy demands while the cancer itself consumes calories and nutrients, creating a perfect storm for weight loss and exhaustion. The pattern of these symptoms also matters. Unlike the temporary fatigue from a busy week or intentional dieting, cancer-related fatigue and weight loss tend to progress steadily over time. You might notice clothes becoming looser, energy reserves decreasing, and a general sense of being unwell without any clear cause. While fatigue and weight loss have many potential causes, unexplained changes that persist for more than a few weeks warrant medical attention, especially when they occur alongside other symptoms like bone pain or swelling. Blood tests can reveal inflammatory markers or abnormal cell counts that might suggest an underlying condition requiring further investigation. Recognizing these systemic symptoms as potential indicators of bone cancer rather than temporary life challenges could lead to earlier diagnosis and more effective treatment outcomes. Night sweats and unexplained fever. Your body's temperature regulation system can become a valuable warning signal when bone cancer develops. Many patients experience unexplained episodes of sweating, particularly at night, that can be severe enough to soak through clothing and bedding. These night sweats aren't related to room temperature or too many blankets. They're your body's response to the inflammatory processes and immune system activation triggered by the cancer. What makes these temperature irregularities particularly telling is their pattern and persistence. Unlike the predictable fever of an infection that typically resolves within a week, cancer-related fevers tend to come and go without clear cause. You might experience low-grade fevers, temperatures just slightly above normal, that persist for weeks or fluctuate unpredictably. These temperature spikes often occur alongside night sweats, creating a cycle of chills and sweating that can significantly disrupt sleep and comfort. The biological mechanism behind these symptoms involves cytokines and other inflammatory compounds released by your immune system as it responds to the cancer. These substances can directly affect your body's temperature regulation center in the brain, triggering sweating episodes and fever spikes that seem disconnected from any obvious illness. Many people dismiss these symptoms as hormonal changes, stress responses, or minor infections. However, persistent night sweats and unexplained fevers that last more than a few weeks deserve medical attention, particularly when they occur alongside bone pain or other concerning symptoms. Blood tests can reveal elevated inflammatory markers that might suggest an underlying problem requiring further investigation. While night sweats and fever have numerous potential causes, their persistence without clear explanation could be an important clue in detecting bone cancer at earlier stages. Recognizing these temperature-related symptoms as potential warning signs rather than temporary inconveniences might lead to earlier diagnosis and significantly better treatment outcomes. Neurological symptoms. When bone cancer develops in or near the spine or skull, it can create a cascade of neurological symptoms that might seem completely unrelated to bone health. As tumors grow, they can put pressure on nearby nerves or the spinal cord itself, creating symptoms that radiate far from the actual tumor site. These neurological effects can manifest in various ways depending on which nerves are affected. You might experience tingling or numbness in limbs, a sensation often described as pins and needles that doesn't resolve quickly. Some patients notice muscle weakness that doesn't improve with rest or unexplained changes in bladder or bowel function. In more advanced cases involving the spine, there may be difficulty with coordination or even changes in walking patterns. What makes these symptoms particularly concerning is how easily they can be attributed to other conditions like herniated discs, peripheral neuropathy, or normal aging. The key difference is their progressive nature and their connection to other symptoms like localized pain or swelling in nearby bones. The neurological symptoms typically worsen over time rather than improving or fluctuating significantly. When cancer affects bones in the skull, additional neurological symptoms may appear, including persistent headaches that worsen when lying down, changes in vision or hearing, or even subtle personality changes due to pressure on different areas of the brain. These symptoms develop gradually as the tumor grows, sometimes making them difficult to recognize as connected problems. While neurological symptoms have many potential causes, persistent and progressive issues, especially when they coincide with bone pain in related areas, warrant prompt medical evaluation. Modern imaging techniques can reveal whether bone abnormalities near the nervous system might be causing these symptoms. Recognizing the connection between neurological changes and potential bone cancer could lead to earlier intervention, potentially preventing permanent nervous system damage and improving overall survival outcomes. Changes in bone appearance on X-rays. Modern medical imaging has revolutionized our ability to detect bone cancer, often revealing concerning changes long before they cause noticeable symptoms. When bone cancer develops, it alters the normal architecture of the bone in distinctive ways that trained eyes can identify on X-rays and other imaging studies. These visual changes vary depending on the type and stage of cancer. Some tumors create areas where the bone appears more dense than surrounding tissue, showing up as bright white spots on X-rays. Others cause bone destruction, appearing as dark holes or areas where the bone's normal structure has been eroded away. In many cases, there's a combination of both increased density and destruction, creating a mottled appearance that radiologists recognize as potentially concerning. What makes these imaging findings particularly valuable is that they can be detected even in the absence of symptoms. Sometimes, bone cancer is discovered incidentally during imaging studies performed for entirely unrelated reasons, perhaps after a minor injury or during routine screenings. This accidental discovery often represents a fortunate early detection opportunity that significantly improves treatment outcomes. Beyond simple X-rays, advanced imaging techniques provide even more detailed information. CT scans create three-dimensional views that help determine the exact size and location of tumors. MRI scans excel at showing how a tumor affects surrounding soft tissues and whether it has invaded nearby structures. Nuclear medicine studies like bone scans can reveal areas of abnormal bone metabolism that might indicate cancer, even when structural changes aren't yet visible on regular X-rays. The importance of following up on abnormal imaging findings cannot be overstated. If you've had imaging studies that showed bone abnormalities requiring follow-up or further evaluation, ensuring that these recommendations are completed could literally save your life. Many patients mistakenly assume no news is good news, but active follow-up on concerning imaging findings is a crucial step in catching bone cancer at its most treatable stages. Bone cancer may be quiet, but it leaves clues if you know what to look for. What makes this disease particularly dangerous isn't just its nature, but how easily its warning signs blend into the background of everyday life, masquerading as normal aging, minor injuries, or temporary discomfort. Yet as we've discovered, these symptoms are far from ordinary when they follow certain patterns and persist over time. By recognizing even a few of these warning signs, whether it's nighttime bone pain, unexplained swelling, unusual fractures, or persistent fatigue, you're arming yourself with knowledge that could quite literally save a life. Early detection of bone cancer can mean the difference between extensive, difficult treatments with uncertain outcomes and simpler interventions with excellent survival rates. If this video helped you understand the silent symptoms of bone cancer, imagine how many others could benefit from this knowledge too. Please subscribe to our channel, turn on notifications, and share this video with those you care about. Your simple act of spreading awareness could be the reason someone seeks medical attention before it's too late. Thank you for watching, and remember, paying attention to your body's subtle signals today could mean many more healthy tomorrows.